The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us for today's webinar, Drug and Alcohol Rules and Regulations, brought to you by the Shortline Safety Institute and the American Shortline and Regional Railroad Association. My name is Michelle Malski, and I am the Safety Programs Manager for the Shortline Safety Institute. And with me today is also Sabrina Weiss, Vice President of Education and Business Services for the ASLRA. Before we begin, I want to let everyone know that we are recording this webinar, and we'll be making the recording available to all participants, so you may go back and review anything that we discuss here today for your convenience. To ensure quality audio for the recording, all attendees are on mute. You will only be able to hear our presenter speaking during this webinar. If you have questions during the presentation, you may type them into the questions bar on your screen, and we will read through all submitted questions live here at the end of the webinar. I'd like to introduce today's speaker, Jerry Powers. Mr. Powers is the Alcohol Drug Program Manager, Office of Safety Oversight at the Federal Rail Administration, or the FRA. In this role, he contributes to safe and efficient passenger and freight rail transportation. He oversees FRA's drug and alcohol program as an essential element in fulfilling that responsibility. Jerry is responsible for all aspects of the FRA Part 219 program. He is also responsible for addressing and closing the NTSB recommendations regarding prescription drug use in the railroad industry. He started with FRA in March of 2013 after 9 years with the Federal Transit Administration, or FTA, as their drug and alcohol testing program manager, as well as their Director of Safety and Security. Prior to this, Mr. Powers worked at the Volpe Center in Cambridge, Massachusetts for 16 years, attaining DOT and DOD-wide experience. And so, without further ado, I'd like to welcome Mr. Powers to the webinar. Mr. Powers?
Thank you, Michelle, and thank you, Sabrina. Thank you all for dialing in and being on the webinar today. I am Jerry Powers. I'm the staff director in charge of the drug and alcohol program at FRA. We're going to go through today a brief rule overview of the new Part 219 and a detailed post-accident training as well. The Part 219 was rewritten and was released in June 10th of last year. And so we'll go through some of the brief highlights of that, some of the bigger points, and then we'll go into a post-accident testing training piece where we'll talk about thresholds for testing, some of the new stuff that's coming out of the 219 rewrite, and tox boxes collection process, laboratory procedures, and at the end we'll look at some of the post-accident testing results, which have been pretty dramatic and surprising lately. The rewrite of 219 is also a big threshold moment as we're adding maintenance of way employees or roadway workers. This is something that's new to FRA, since we've always covered just hours of service or covered service employees at railroads up to this point. Now, as FRA was first out of the gate in drug testing in DOT in the mid-'80s, it was a bit more conservative while looking at the safety-sensitive categories, and we didn't have the department or the law behind us like the other agencies in the DOT did. So I think it was a look at limiting the breadth of safety sensitive. So we never had maintenance of way workers and mechanical employees applicable to Part 219 of drug testing. When I was at FTA, we had both of those right out of the gate in 1994. So we're really struggling 30 years later to add some of these safety-sensitive categories that, our sister agencies had 20 years ago. So, like I said, the Part 219 rewrite and the addition of the maintenance of way was published in June 10th, last June 2016. The implementation date or effective date of that is June 12th, 2017. So everybody's going to have a amended random plan or Part 219 plan to cover the maintenance of way and how are you going to actually implement the random testing of those folks. That's going to have to be approved by my office, and so we're going to need you to submit initial or amendments to your FRA for coverage of maintenance of way in your plan. You're going to have to receive approval of that plan in advance of the effective date, and you have to notify and train your employees on those changes. So don't wait until the last minute, because we don't want to be deluged with 500 plans at the last minute. If we will get them and approve them before that date. You can also start testing before that date under your own authority on June 12th, 2017, and hit tests that occur after that. You can flip the switch onto federal DOT testing. Okay, some of the significant differences between what came out in the Notice of Proposed Rulemaking or the NPRM versus what's in the final rule. There was two significant differences in the final rule as opposed to the NPRM, which came out in the summer of 2014. We adopted our Part 214's definition of roadway worker to define maintenance of way employee under this part. Now, previously in the NPRM, the Notice of Proposed Rulemaking, the definition of MOW was quite a bit narrower. We had a lot of support for widening that so that FRA would have one definition and the industry would have one definition of what a roadway worker or maintenance of way employee is. We also withdrew our proposed peer support requirements, as there was a lot of negative comments on that in terms of a federal regulation addressing peer support programs such as Operation Red Block or some of the other ones that are out there like OpStop or DARS. It was felt that federal regulation shouldn't really go into the area of peer captains and peer support programs. We agreed with that, so we pulled that, and Subpart E, which is the identification of troubled employees, currently remains much the same, although it's been recategorized into Subpart K. There's a link to the new Part 219 here. Of course, that makes exciting bedtime reading for all of you. Also, we have the roadway worker definition at the bottom from Part 214 as well. Some of the changes came about because this is the first major update of Part 219 since it was first put out in the mid-'80s. So a lot of what's happened in terms of interpretation and subsequent letters of interpretation and what's been codified in the compliance manual was gathered up into what they call in the government a retrospective regulatory review. This is essentially the rewrite of Part 219. At that time as well, we also had the Rail Safety Improvement Act of 2008, which Congress required us to add maintenance of way employees to drug testing as well. In this last bullet here, we found a disproportionately high level of positive test results amongst our deceased maintenance of way employees. I know this is pretty small. I can see Michelle across from me leaning in to look at these little tiny 6-point numbers here. But the key is we're looking at fatally injured employees in rail accidents for this millennium, the last 16 years. And you can see the positive rate for covered service employees has been up near 7%, 6.8%. The second line down is the fatal for maintenance of way employees. And the only time we test a maintenance of way employee currently before June of next year is when they're fatally injured at this point. The results haven't been too encouraging. We're looking at 14.3% over the last 16 years. in comparison, you can see we see very few tests of fatally injured mechanical or hostler employees, or mechanical employees performing hostler duties, but they're at comparable to the hours of service positive rates as well. But what we're seeing is a lot of usage and indicators of usage amongst maintenance of way employees. NTSB's pointed out a couple of serious accidents where there was levels of impairment amongst roadway workers as well. Okay, so like I mentioned, the RSIA recognized this abuse amongst maintenance of way employees and directed us to add them to Part 219. So we're going to introduce maintenance of way employees to the random drug and alcohol testing at the same initial minimum random rates that applied to covered employees, and that is 50% annual minimum rate for drugs and 25% for alcohol. As you know, now covered service employees are at a rate of 25% annual minimum for drugs and 10% for alcohol. The way that the department set up these programs initially is a sort of risk-based approach where an employee class will remain, or a mode industry transportation rule will keep it at 50 and 25 until the positive rate can go down under 1% for 2 straight years. At that point, rates can drop, and the annual minimum drug random rate would drop from 50 to 25%, and the alcohol rate would drop from 25 to 10%. So as it is now, covered service and maintenance of way will be in separate and distinct pools. You can have a separate pool for your maintenance of way employees. We would recommend a consortium for very small employers or very small railroads, where they would group these in with other railroads to have a better random selection testing program. Also, we've added a new definition to encompass both hours of service and covered service and the maintenance employees, and that's going to be known as a regulated employee. Here's a little icon of the Federal Register notice next to that, and I think I have a link on that too later on in the, or is it before? Yeah, it's in this slide here. Okay. Adding regulated employee 219 will be applicable to those employees who directly perform maintenance of way, but also responsible for the contractors and subcontractors. So if those contractors and subcontractors are standing in the shoes of one of your employees, or basically doing the function of what would be a direct employee of the railroad, they would be covered. It's been the practice, FRA's practice, to hold railroads, contractors, and subcontractors equally responsible for ensuring that their employees who perform maintenance of way activities are in compliance with the requirements of this rule. In the final analysis, if the subcontractor or the contractor can't handle the program in a compliant manner, we're going to look at the railroad as the final responsible entity here. So you have to keep an eye on your contractors, make sure that you get contract language where they assert that they are complying with Part 219, and take a look at their testing as the year goes along. Okay, partial compliance. We have the small railroad exception. Previously, and we're talking a small railroad here, you're talking about a total of 15 or fewer employees who are covered service. Now, maintenance of way is not going to add to that count, so it's still going to be, partial compliance will still be determined by 15 or fewer covered service employees. Previously, a partial compliance railroad only needed to perform post-accident testing. With the new Part 219, a small railroad now excludes only reasonable cause and random testing. So the railroad will be responsible for pre-employment and reasonable suspicion, which is new for small railroads or partial compliant railroads. This piece down the bottom here, a maintenance of way contractor that works exclusively for small railroads also qualifies for the small railroad exception. If they perform maintenance of way activities or roadway activities at a full compliance railroad, then they would be subject to Part 219. Okay, I won't cover too much of this one here. This is just saying that each railroad has to ensure that the contractor has had a negative pre-employment. We're going to get into pre-employment a little bit more later, in that your current maintenance of way employees are going to be grandfathered when this rule comes in. It's just going to be pre-employment testing required for new maintenance of way employees. Okay. Let's see. And that's covered in the third bullet here, the grandfathering. So the fourth bullet saying new employees will have to be tested after June 12th for pre-employment, June 12th, 2017. Okay, some of the other stuff that happened in the final rule or in the rewrite of 219, we used to have reasonable cause and reasonable suspicion crammed into the same section, which was subpart D of Part 219. The only thing that reasonable suspicion and reasonable cause have in common is the word reasonable. So we've decided to clarify that, the difference between the two, and split them out into two separate subsections. So reasonable suspicion is now subpart D, and reasonable cause has been moved to subpart E. So that's just a little housekeeping. Another substantive change to the rewrite is on Rule G checks. Part 219, the current Part 219 was silent on Rule G checks. Our compliance manual always called for 4 per year per covered employee as guidance. And this is, take the sunglasses off your folks, see if anybody's home, check for impairment. We have to the right here this little beer can that we found down in Norfolk. They produce this beer. It's called Rule G India Pale Ale, which is a laugh. Supervisors are required now by the regulation to record the Rule G observations at a minimum of 2 per regulated employee per year. Okay, exceeding hours of service. I won't go through all this verbiage. There's a lot of words on this slide. A railroad is essentially not excused from performing subpart C testing and reasonable suspicion testing as if it would violate the hours of service laws. We'll go through another slide on recall a little later on in the post-accident section of the presentation. In the reasonable cause testing, a railroad can exceed hours of service to get the testing done, but they still have to report any excess service to FRA. The exception here is that in random alcohol and drug testing, you have to allow sufficient time to complete the test. And a shy bladder period for a drug test can take 3 hours. If somebody's hours of service expire before that time, then they just won the lottery and they can just walk out. We will not have any violation against that person, or it wouldn't be considered a refusal to test. Once their hours of service expire, the random test is finished from our standpoint. Okay, reasonable cause. The big change there is that employer was authorized to perform reasonable cause testing. This is in the current rule. They can switch back from federal authority or company authority in any event that meets the Part 219.301 criteria. Now in the new rule starting next June, employers going to have to just pick what side of the fence their reasonable cause testing is on. You're either going to have to use DOT authority or company authority. If there's advantages and disadvantages to both, in DOT authority, of course, you can use any violation of that to affect the person's certification, locomotive engineer certification or conductor certification, and which you can't do if you had a company positive or violation. The advantage to company testing, however, is that you can expand your panel to a 10 panel of testing or a wider panel of testing than DOT allows. The DOT standard panel is the 5 panel testing, and it's pretty conservative, and we're looking in the next year to get a rule out of Health and Human Services which would allow us to expand to synthetic opioids, which are currently not covered. Okay. I'm going to switch gears here now into the post-accident training. Also going to show you a few elements of that are going to be changing with the new rule next June. Okay, moving on. There's a link at the bottom of this slide, and this is our post-accident decision flow chart. It's not meant for you to be able to read very well here, but that link at the bottom will bring you to the decision tree. We always have these handy, myself, my deputy Sam Noe, Sandra Volante, who also works in the FRA 219 program. We keep these under our pillow. It's a very complicated scheme, the post-accident testing decision. So we go down through this flow chart, and usually when we get a call from a railroad, we'll go down right through it with them. And it's a very helpful tool. We're going to be updating this as well because we have changes. We used to have an exception to testing and grade crossing accidents. Now there's an exclusion to that exception. So this will be updated. Okay, the qualifying events currently for post-accident, there's a major train accident, impact accident, passenger train accident, and a fatal train incident. All of the first, all have to meet the $10,500 monetary reporting threshold for Part 225. That's the accident threshold, except for the fatal train incident. We would be testing in a fatal train incident even if it didn't meet the monetary threshold. Now, post-accident testing is again separate and distinct, and it's FRA's own custom program. It's not the 5-panel testing that you see in pre-employment, random testing, reasonable suspicion testing. So this is a much wider panel of testing, and we draw both urine and blood in these subpart C accidents. So generally, we've been seeing about lately 60 to 80 subpart C qualifying accidents each year with about 200 tests nationwide. The exceptions from testing in subpart C would be highway rail grade crossing accidents at the moment, wholly natural caused accidents or incidents, floods, tornadoes, etc., or those that are caused by vandalism or trespassers. On the highway rail side, I'm going to be going through these pretty quick. So if you have questions, please save those, write them down, and Michelle and Sabrina will get to them at the end. One rationale for the exception is that trains can't stop at grade crossings, so it was always thought that vehicles cause all these accidents. If the train crew has no nexus to the accident, then they should be excluded from testing in grade crossing accidents. The majority of those accidents are caused by the motor vehicle incurring in the right of way. In this last bullet, in the case of a mechanical employee struck by a hump yard switching crew, while backing a pickup onto a yard crossing, the exception wouldn't apply, as this would be qualifying post-accident testing event, as it's in the yard. It's not at a actual grade crossing. Okay, New starting on June 12th, we're going to have an exclusion to the exception. This is one of the joys of being in the federal government, is that you can have exclusions to exceptions and you have to explain them to people. In response to the NTSB recommendation from 2001, we're going to require post-accident testing at highway rail grade crossing accidents whenever there's reason to believe that a regulated employee has interfered with the normal functioning of the grade crossing signal system without first providing for the safety of the highway traffic. Also, events involving violations of flagging duties and events involving the violation of an FRA regulation or railroad operating rule by a regulated employee that may have caused a role in the cause of severity of the accident. So we'll be looking at each one of these as the test. As the railroad calls us on most of these. If you have an accident, you have any questions, please call myself, please call Sam. We'll go through them. We're going to go over them with a fine-tooth comb because we really don't want to have a raft of testing in railroad operating rule violations that really didn't affect the cause of severity of the accident. Now, we don't want to see, for example, somebody got tested because it showed that the person in the maintenance of way vehicle didn't have their seat belt on, for example, that kind of thing. It would really be a rule violation that had a role in the cause or severity of the accident. Okay, a major train accident. This is a rail equipment accident. Like I said, we define the accident at 10,500 or more. It involves a fatality, a release of hazmat with an evacuation or a reportable injury, and $1 million plus in railroad property damage. Now, this is a major train accident. Now, that threshold is increasing to $1.5 million next June. And in a major train accident, you don't have to think too much about who to test because all crew members of trains involved get tested. Our definition on evacuation is the relocation of people to a safe area to avoid exposure. It's initiated by local authorities, usually by a responding fire or police department. It can either be in mandatory or voluntary evacuation. Okay, on homeowners and businesses also evacuating an area without being directed to do so. Even if they did evacuate, if they weren't directed, that wouldn't be qualify as an evacuation for testing purposes. Okay, on the hazmat for fuel oil spills, if there's a fuel oil spill from the tank of the locomotive, although that's a hazardous material, wouldn't be considered hazmat because it's not lading, nor would it be considered a release of hazmat lading if a fuel tender spilled its fuel oil. So if the fuel tender is not part of the locomotive consist, however, any fuel oil spilled from that would be considered hazmat lading. Now that interpretation comes from years of dealing with these and the wisdom of my predecessor, Lamar Allen, and I'm sure they had gone through many of these spills, and so they've decided where to draw the line in the sand where these things go. So these are now codified into the regulation, and will also be covered in the new compliance manual. Okay, impact accident is where you start looking at who had a role in the cause of severity of the accident. You don't just test everybody. Impact accident is defined as a rail equipment accident of 10,500, which has either a reportable injury or 150,000 or more of railroad property damage. And that includes impacts with bumping posts, but not with fallen trees or natural cause things like rock slides. And it doesn't include impact with already derailed equipment or raking collisions with lading, such as lading striking a bridge. A passenger train accident is defined again as the 10.5 threshold. It involves a passenger train in revenue service A passenger train is defined as an intercity, commuter, or other short haul or excursion service. Any reportable injury to a person in the accident, an employee, a bystander, a passenger, etc., you would have to test those who were involved in the cause or severity. In a fatal train incident, this doesn't use the $10,500 threshold. Again, it's any train incident that involves a fatality within 12 hours to an on-duty railroad employee or hours of service contractor. Okay, this is involving the operation of on-track equipment, and this is where we've tested maintenance of way employees in the past, as they're not covered employees. So you can see in that second bullet, it says they have to be a covered or a non-covered employee. And there would be no railroad property damage threshold again, and the fatally injured person themselves can't be excluded from testing. In an impact accident, you have fatal train incidents. You also meet the criteria for major train accident. You have to classify that as a major train accident. So you're taking the accident with the more serious, the higher standard is for the major train accident. So you're testing all the crew members there instead of looking at who had a role in the cause or severity of that accident. So if you have the other various ones where you're looking at cause or severity, the major train accident would override those, and you test all crew members. Sometimes we have you could have a fatality, hazmat release, and an impact of over 150,000 in a major, all in the same accident. Okay. So you must test all assigned crew members again in a major train accident. You can exclude crew members if it's clear that they didn't cause or contribute to the accident for, again, the impact passenger train accidents and fatal train incidents. There's a small point here too. If there's a deadhead crew on the train, they would not be considered as crew members, and they would be excluded from testing. And this, it says here in my notes, this interpretation is from August 2nd, 1985. So it's a long-standing interpretation. Okay, covered employees must be kept on duty until the testing determination is made. If they fail to remain on duty, that's considered what? It's a refusal. So the railroad should still try to contact the AWOL employee for testing, but we haven't had, in this millennium, I think we've had one refusal for testing in post-accident. So it's not happening that often these days. Okay, recall from post-accident testing, we talked to a little bit earlier. If some employee can be recalled for post-accident testing if they were released from duty under normal procedures, if the preliminary investigation indicates a clear probability that the employee played a major role in the cause of severity, and if the accident or incident occurred during the covered employee's duty tour. Now, what's changing in the new rule is that the accident incident doesn't have to occur during the employee's duty tour. They just need to have played a clear that they played a major role in the cause of severity. So what we've seen in a lot of accidents is that one crew will leave the switch misaligned, go off duty, the next train coming through collides with their train parked on a siding, and we end up having to test the guys who had no causal connection to it at all, while the other guys who are off duty can't be recalled because it didn't occur during their duty tour. This explains that, this slide does, and it's eliminated the previous requirement that it had to have occurred on the post-accident testing event had to have occurred during the employee's duty tour. I won't belabor the language there. Okay, in all 4 qualifying events for post-accident, if an operator, a dispatcher, signal maintainer, any other covered employee, including a hours of service contractor or a volunteer, if they're directly or contemporaneously involved in the circumstances, they need to be post-accident tested as well. So in many cases, as with a switch being misaligned and so forth, we'll check to see if the controller, if there's a contracted control dispatch outfit, if that controller talked to the crew and reminded them to realign that switch. In some cases, if they didn't, they'd be tested. Many times we test signal maintainers as well. If it's clear that they had a cause or a role in the accident. Okay, I think I covered this one. If multiple criteria are met for accidents, you just test for the highest testing category. So if it meets a major, you test everyone in all the crews. Okay, employees' consent. Remember that a covered employee has consented to testing just simply through the performance of their hours of service duties. And that goes for a railroad employee, hours of service contractor, volunteer as well. And they've consented to post-accident test even if they have died as a result of the qualifying accident or incident within 12 hours of that event. Okay, prepare in advance, and this is the key. I know a lot of you have post-accident tox boxes, rattling around in your trunk or, under your desk in your office. You should really make sure that they're in good shape, have the latest instructions, have blood tubes that are not expired or past the expiration date, that you have all of the gear that's needed in there. We're going to go through some of the elements, each of the elements of the tox box. So in the instruction sheet, there's going to be three copies of the instructions for the employees. Those are there's 3 kits in each tox box, so there's an instruction for each employee that you could test. There's also 1 set for the railroad representative, the blood collector, and the urine collector. Of course, the blood collector and the urine collector could be the same person as well. Here's a picture of the fatality tox box and a regular standard tox box on the top right. Make sure your current blood tubes, again, are not expired. If they are expired on the labels, I think our last expiration date was for August of 2016. If they're expired, you can email our colleague, Sandra Volante, or you can email Quest, who is our post-accident testing laboratory, directly at that email address. You provide your name and mailing address, we'll get them out to you. If you have a qualifying event and the tubes are expired, you can ask the hospital to replace them with their own gray top blood tubes, which is preferred, or any other tube that's 10 mils. You can also try the expired ones. Usually they have a vacuum, and the vacuum wears out over time, but it generally will still pull blood for quite a while after the expiration date. Also, make sure you have the Quest shipping label that's for our lab is in Tucker, Georgia. A lot of people still have the old Quest address or the Northwest Tox address on the shipping label. We have boxes going to laboratories that don't exist anymore, so make sure it's Quest in Tucker, Georgia. Okay, also reviewing the testing forms inside the tox box. We have one form is the 6180.73, known as the Form 73. That's to be completed by the railroad representative, and that's sort of the who's, what's, and where's of how of the accident, and it shows who's being tested, what the testing threshold was on the form. Also, there's 3 Form 74s for each kit in that box, and those are the testing forms for each employee. We also show the seals here in the middle at the bottom that go with each Form 74. Those would be the urine cup, the urine bottle seals, and the blood tube seals for each employee. Now, we're going to have updates to these forms. They're going to change with the new regulation. The instructions are changing as well, so we'll be sending out a complete package of new forms and instructions. Okay, standard tox boxes. You should have at least one standard tox box. The first one is free. You have to complete a tox box order form and fax that to Quest. Each tox box has 3 kits inside to collect from 3 employees, 3 of your employees. Now, if you're a short line railroad, there's no reason you should have 10 kits hanging around at your property. We've seen a lot of that. We've seen 7 miles of track with 10 kits, or 10 boxes with 21 separate kits. That kind of thing, 30 kits. So the reason that is that when the blood tubes were expiring, I think that folks went ahead and ordered new boxes instead of just letting the new tubes be sent to them. So what happened was we had an explosion of tox boxes out there, and we ended up with 14,000 tox boxes. So you're going to make sure that you have up-to-date blood tubes. Again, the current expiration date on the blood tubes is 2018. We sent those out in this fall. This photo indicates I think it's pretty blurry, but it indicates an expiration date of 9/2012. Those labels should be on the outside of your tox boxes. Any damaged boxes should be replaced or retired. You have to notify us when you destroy or retire a box so we can keep the count of your boxes and maintain and send out the blood tube refreshments, keep that all up to date. Like I said, when I first got here, we had 14,000 tox boxes out there. When you're talking 6 tubes for each tox box, so 6 blood tubes, we're looking at almost 80,000 blood tubes that needed to be replaced every 2 years. We also had 6 different refreshment dates. So now we've got that down to 1 date. We've got the tox boxes reduced down to about 6,000 that have been accounted for. I think some of you may have seen this spreadsheet that we sent out, and thank you very much for helping us organize this. We saved a lot of money here. The 80,000 blood tubes, glass blood tubes cost a lot of money, and very few of them being used. It's a big waste. And so we've got that cost down, the biannual cost every couple of years down to about 23,000, where we were spending, when I first got here, I got an invoice for $75,000 in blood tubes. The first month I was here, I was pretty shocked. So thank you for helping us organize that. In terms of collection, post-accident, the collections need to be timely. We want to see the collections done within 4 hours. If they're not completed within 4 hours, you have to let us know. A lot of times we work with railroads trying to get a medical facility that'll do these. I get on the phone a lot. Sam gets on the phone a lot with medical facilities throwing around authority that we don't have, but we do get actually get them to do the collections by talking to hospital administrators a lot. Any violation or non-compliance with this will be an assessment from our standpoint of the railroad's inaction or level of effort in getting the employee to the medical facility. We'll understand if you're having trouble finding a medical facility that'll perform the testing for you. Okay, this is a big point. If an employee needs medical attention, that takes priority. The treatment takes priority, should not be delayed. Let it go. We can get the specimen later. We don't want to kill anyone trying to get specimens for the post-accident program. So please make sure that you're very strict on the fact that people need to get the care that they need in these accidents. Okay, post-accident specimens need to be collected at an independent medical facility. That's a hospital, clinic, laboratory, or a physician's office. You need to check, try to have pre-checked out beforehand. folks that'll do this for you. You don't want to find out that people don't want to take the liability the day of that you're having the accident, that you're trying to get the testing done. It's better to know beforehand. Okay, you cannot have, also you can't have your normal urine collector for your random program come out and do post-accident specimens. Why is that? They're not licensed phlebotomists. They can assist at the medical facility, but if the medical facility has no objections. The second bullet here is blood has to be taken by a medical professional with extensive experience with drawing blood. Those folks at the medical facility, they don't have to be Part 40 certified collectors, so they don't have to do pre-employment or random tests as part of their regular duties. Here's an image of the blood tube. Like I said, again, you should have received new blood tubes this fall with the 2018 expiration date. And I covered this. You'll be receiving new updated forms, instructions, and the FRA administrator's cover letter in spring 2017. Now, she just signed this. What's today, the 20th? So our administrator, Sarah Feinberg, signed this on last Friday. This is the cover letter telling folks at the medical facility that this is an important testing program for the federal government, and hopefully get their cooperation with performing post-accident testing. Here's a clarification for the post-accident testing. A urine can be collected from an employee who's been catheterized for medical purposes, whether they're conscious or unconscious. And this is for post-accident subpart C testing only. None of the other testing areas would this be subject. The same goes for blood. Blood may be taken from an injured employee, whether conscious or unconscious, subject to the physician's determination that they can do that without hurting the person's health or putting them in danger. But again, by operating in hours of service as a regulated employee, you're given implied consent to providing these samples. Okay, completing and preparing the collections for shipment. The person preparing the shipment, the specimens, can either be the blood or urine collector or another member of the medical staff. It could not be you as the railroad representative. They transfer the shipping box to the railroad representative. The person responsible, they carefully package the specimens for shipment. They seal the collection kits and the post-accident shipping box. They transfer the shipping box to the on-site railroad rep or directly to the overnight courier. It's probably better for them just to go to the overnight courier directly. Once the collections are complete, skip to step 5, where the medical facility will initiate the chain of custody by showing the receipt of the urine and blood specimens. Step 5 should be completed not by the railroad representative, but by the collector or the medical facility personnel. And this is step 5 there. It says here, I certify that I took possession of the sealed specimens, and the sample set identification number is printed above from the blood and urine collectors. So this is filled out by the medical facility personnel, and then they can say down the bottom here that they release the specimens to a railroad representative, but they fill out step 5 on this 74 form. Okay, transporting to the lab. These are images of the shipping container security seal and of the mailing label. After sealing the box with the red seal, they apply the Quest shipping label and place the Tox box in a FedEx or overnight shipping envelope and attach the courier address labels and ask the facility to make sure that goes out ASAP. If weekend service is not available, they can ask the medical facility to refrigerate. What you shouldn't do as the railroad rep is take the box with you, throw it in the trunk of your truck or in the back of your car, and throw it in the motel refrigerator. We really need a good chain of custody here. It's better just to let the medical facility FedEx it out directly. Okay, this is the current lab address. So you want to make sure that that's on the shipping label in your boxes. These are some images of Quest Diagnostics. That's actually the bottom one is where we go in Tucker, Georgia. So we audit that laboratory 3 times a year. We look at each post-accident case to make sure that it's legally defensible. Okay, switching gears here. This is the post-mortem post-accident tox box. When you have a fatality, you have to notify the National Response Center. That's the number there. If you don't have a fatality box, and as short line railroads, none of you would have one. Generally, only the Class 1 railroads have the fatality boxes, but we can get one to you from FRA, or we can arrange to have Class 1 provide one to you, and we will send them a replacement box. Hopefully, you never have to use these, but this is what the fatality box looks like. It's a light blue color. In addition to the urine and the blood specimens, there's you can see on the previous slide here, there's collection canisters for tissue and vitreous humor and other fluids. So the railroad representative completes Form 73, and the medical examiner or the coroner would complete the collection form in this case. Okay, notification of event. You can telephone myself at 202-493-6313. Leave a message to include the name of your railroad, the accident date, time, location, type of event, number of employees tested. But what you really want to do is call Sam. He's at the second bullet here, and make sure you let him know that information as well. These numbers will be here. You have a copy of this presentation at the end. The current post-accident testing panel, what we test for, this is just subpart C, again, not what we test for in the random program or the pre-employment testing, but the current panel we're looking at includes the Part 40 panel, which is the 5 panel to the right of this bracket, and that's marijuana, cocaine, amphetamines, opiates. We're talking organic opiate compounds there, and that's codeine, morphine, heroin, and 6-acetylmorphine, which is a byproduct of heroin, or the marker for an organic opiate, as well as our good old friend PCP. Plus, we also cover benzodiazepines, and those are prescription drugs. Those are tranquilizers like Valium, Xanax, Ativan, those type of things. We test for barbiturates as well, alcohol, and we also test for synthetic opioids, which are laid out in this slide here. So we're currently testing for, let's see, what do we got here? 8 synthetic opiates, and on the left we have the active ingredient. On the right is the brand name of those products. Okay, on the test results, FRA, the laboratory will overnight the test results to the MRO and the FRA, and also mail results directly to the employee. If positive, again, like the regular program, like random testing program, the MRO will interview the surviving employee to check if they have a legitimate explanation for the substance being in their blood or urine. That is, they have a valid prescription for that medication, or they were administered that at the hospital after the accident. The MRO reports those test results to you as the railroad's designated employer representative. If you don't hear anything, keep checking with the MRO to get those test results. This is what we've been looking at as a trend in post-accident this is since we started the program back in the way back dark days here of the late 80s. You can see we're up at about 5.5 or 6% as a post-accident positive rate. Then we went down over the next 5 years till we got to a pretty steady state where we had a positive rate of between about 0.5% a year to maybe up, 2.5 or 3% in the worst years. Down to the point where in 2014 we had absolutely no positive tests. Things have changed dramatically since then, as you can see. We had almost 3% positive rate last year, and so far this year, this is through about the end of July, I believe, we're looking at almost an 8% post-accident positive rate. We had 4 positives in a 24-hour period this spring in April. We've had looking at 3 marijuana, 4 cocaine, our first ecstasy. We were pretty excited about that. A benzodiazepine without a prescription, 1 OxyContin, and 1 morphine positive. So again, the expanded panel casts the net much wider than our random testing. So, we see a lot of things here that we wouldn't see in the random testing. But so far in 2016, this is our highest positive rate ever. And so it's been getting a lot of attention from the higher ups in the FRA. Our non-covered positive rates are much higher since 2003. Again, we've seen mechanical at 33% and maintenance of way at 14% positive. Here's my contact information, myself, Sam Noe, Sandra Volante. You can reach us anytime, 24/7. Those are our email addresses there. We also work with our oversight contractor, George Ellis, who helps us with our post-accident laboratory program. We have 2 attorneys in the program as well, Elizabeth Gross and Patty Sun.
Okay, so I'll just remind folks here, we're going to go a little bit over, so stick around for questions. We've certainly got the time here. If you need to jump off the line, as Jerry already said, we will make the slides available along with the recording of the webinar to everyone after the fact. We do have a number of questions that have come in as Jerry was talking, and so if anyone else has questions, feel free to type those into the questions bar on your screen, and we'll try and get through as many as possible before Jerry times out. So I'll hand this over to Michelle and let her start with the first one here.
All right, so the first question that came in is, will the FRA be providing detailed guidelines to the short lines and their small subcontractors so we can properly implement our drug and alcohol policies and random drug testing? In our case, we work as a subcontractor for both small railroads and larger ones. Therefore, I assume we need to adhere to the larger railroad guidelines.
Yeah, that's correct. You'd have to have a fully compliant program. You also need to get in an approved random testing plan from FRA. We're going to have model plans available for various sizes for small contractors, large contractors, small railroads. We're also having a new compliance manual that we're going to come out with in the spring as well. I don't know if we'll have it fully blessed by our whole agency, but if not, we'll provide some guidance for getting this program done. We realize it's a complex, pile of requirements that you're subject to in Part 219. But like I said, from the model plan and the compliance manual, we should be able to help you out quite a bit with that.
Excellent. Thank you, Jerry. We have the next question here. We have only 2 maintenance of way MOW employees, not in a CDL pool. How do we handle those 2?
We're going to work with the NRCMA on trying to and also some of the third-party administrators try to put together a maintenance of way consortium where for employers that have very small numbers of maintenance of way, like you said, that aren't covered in the CDL pool. You could randomize instead of the problem you would have with 2 employees is that you'd have to do a poll at least a minimum once every quarter, and you'd have to test those 2 employees do 4 tests for 2 employees annually. But if you're in a consortium with others who are in the same boat, then you can pull at the right percentage, so you get 50% expectation on that. So we're trying to work within our CMA to try to develop a consortium for those type of employers.
All right. Will paperwork in PAFRA white boxes change?
PRFRA white boxes.
PA, like Pennsylvania.
Yeah. I think it's post-accident FRA box.
Oh yeah, I think I mentioned that. We'll send you a whole new package. So the instructions and the forms you'll pitch all those, and we'll replace them with a completely new package.
Okay. All right. Thanks, Jerry. The next question we have is a shelter-in-place, road closures, traffic rerouting considered equivalent to an evacuation?
No, I don't believe so. I think it would have to be an actual order of evacuation.
Okay.
But that's a good place. Was that shelter-in-place, road closings?
Yep, and we'll save the entire list
Okay.
of questions that we've got here, so you can go back, take a look at them. If you want to modify answers or
Yeah.
get additional information, we can send
Okay.
responses out to folks.
I mean, if the road closing or shelter-in-place was also hand in hand with a evacuation order or a hazmat release, that would be something we'd have to consider.
Okay, another question for clarification. Does excursion service include currently excluded non-regulated exclusively tourist railroads?
I believe so.
Okay.
All right.
But you want to save that one for later,
Sure.
I believe.
Does the FRA have legal regulatory over hospitals, clinics, doctors,
No.
medical professionals?
No, we throw around a lot of authority with them, though, that we don't have. And, I've gotten pretty good at saying, you're impeding a federal investigation, that kind of thing. And that works in some cases, but, we feel your pain. A lot of times we've had people drive around to 6-7 clinics before they get a crew tested. We're piloting another technique with a Class 1 railroad as well to try to maybe have a 24/7 nurse of the medical review officer staff to order a script for blood work, and we're seeing how that's going to work. So, that they would have a prescription for doing blood work, essentially.
Will roadmasters have to be in the random pools?
Roadmasters.
Roadmasters.
Roadmasters. No, it's on function. If you look at the roadway worker definition, if they perform a function in that definition, then yes. There's nothing inherently safety that meets that function just through being a supervisor.
All right. We have 3 DOT pools, FRA, FMCSA, and PHMSA, FPHMSA. Could we potentially have our MOW, maintenance away employees, in these pools and not in the new MOW pool?
Well, the MOW pool tests at a higher rate than the other pools. So if you put them together, you'd have to test at the higher rate, the 50-25. So you could, I guess, throw your CDLs in with your MOWs, but you'd have to be testing your CDLs at 50-25, whereas FMCSA only requires 25-10.
Okay. All right. Under Rev 219, can you hold beyond hours of service if reasonable cause testing beyond .301 situations, but under company authority?
Can you repeat that, Michelle?
Yeah, sure. Sorry, it's pretty small font, so I apologize if I can't see it all here. Under Rev 219, can you hold beyond hours of service if reasonable cause testing beyond .301 situations, but under company authority?
And if that doesn't make sense, you can say so, and we can always. get
Yeah,
back to the
that's a
person.
good question. If you're testing under company authority, I guess you could do anything you want to do, but you can't test for reasonable cause if you're not meeting a criteria under 301.
How do we?
I guess,
All right.
go ahead.
How do we get a copy of PAT letter signed last week?
We're going to send that out again with the package of the new instructions and the new forms. I guess we could send you a scan of that if you'd want it beforehand.
Okay.
You could just reach myself or Sam or Sandra.
Okay.
Will the FRA be providing guidance on the threshold for contractors that will be covered? Examples such as bridge inspectors, snow removal, weed spray, paving, geometry testing?
Yeah, we're going to have to, we realize that we're going to have to put out a lot of interp on that kind of stuff. And certainly, the de minimis clause comes into effect there too, where somebody performs a maintenance of way duty, but maybe once in a quarter, then they would go into the random selection pool for the next quarter. If they didn't perform in that quarter, then they would fall back out of the pool. So there's be a lot of pool maintenance with people that do very sporadic regulated functions. Also, I mean, you can take advantage of the waiver process as well if there's situations where there's a natural disaster or a heavy blizzard or snow removal needed.
Okay.
All right. Will small contractors, meaning one man, be required to join a consortium and have themselves tested?
Yes. And we would, we'd require that you'd have to join a consortium if you were an owner, operator, sole employee of a covered function.
Okay. So a few of these final questions might be referring back up to questions that were asked earlier. They've sort of been coming in at the last minute. So if you've already answered it, just tell us that. But we can kind of go through these quickly, I think.
What if the roadmaster is inspecting track? Would that make him go into the pool?
I think so, because you'd have the potential to foul. And so he'd go in the pool for the next draw. If he sporadically performed that function, he would go in for the next draw, but could fall out if he didn't perform that function in the subsequent quarter. So we're talking about the de minimis random pool rules here. I'd like to clarify too, before I said you could put maintenance of way in with CDLs. That's really where you had a CDL who was performing a maintenance of way function. So in the 50-50 rule, you could say the CDLs, it wouldn't be just a purely CDL would have to remain with the FMCSA. I think that if they perform both roadway worker duties and CDL duties, then they could be in a roadway pool.
All right. The last two questions are just for clarification.
Okay.
Jerry? So the first one is just to clarify, if employees meet definition of regulated employee, they need to be in maintenance of way pool, not, for example, PHMSA?
Correct, because they'd have to be in the pool that tests at the higher rate.
Okay.
And one more for clarification. The new term regulated encompasses both hours of service and maintenance of way. Is that correct?
Yes. And so, yeah, so it would be an umbrella over hours of service and maintenance of way. Or a roadway worker, I should say. I imagine there's some maintenance of way employees who aren't covered by the roadway worker definition, who, for example, work purely in the shop, that kind of thing.
Okay.
We've got one last one that we kind of skipped over to get to some of the meat, but this is more of a question about what FRA is seeing. So we'll throw this one out there, and then I think we'll wrap it up.
All right, Jerry. Is the FRA seeing increases in marijuana testing hits in states that have legalized casual and medicinal use?
Yeah, we have actually, and the random rate's gone up about we don't have the random numbers for 16 yet, obviously, but the random rate from 14 to 15 went from about 0.3 of 1% up to half of 1%. So that's a big jump. And we've also seen quite a few marijuana positives in the state of Colorado.
Okay.
So the overall, the state regulation and permissiveness is sort of leaking into the industry over the last couple of years, and you probably need to reinforce that message that it's not okay just because you have a recreational marijuana law, that you're covered by a federal testing program.
Excellent. Well, thank you very much, Jerry, for your presentation. I think that covers it for our questions today. If you that are attending still, if you have any additional questions or issues that you want to discuss directly with our presenter, Jerry Powers, you may contact him directly. And his contact information is still provided on the final screen that you can see on your screen there. If you would like to provide any further feedback or suggest topics for future webinars for the Shortline Safety Institute, please feel free to contact me, Michelle Malsky, the Shortline Safety Institute Safety Program Manager, or at Sabrina Weiss with the ASLRA. Our contact information is also on this last screen. Thank you all so much for joining us, and have a great and safe afternoon.
Thank
Happy
you.
holidays.